Hello and welcome once again to Hude Hour, right here on Hude Network, our flagship program, where we break down issues within the humanitarian and development space, discuss across a host of developmental issues. But the goal is sustainable development, growth, and prosperity for all. I am Amadin Ogbewe. Welcome to Hude Hour, pardon me.
And I am Joan. Thank you so much for joining us. You're welcome. Hi, Amadin.
Hello, Joan.
How are you doing today?
I'm good. I love your color. Today is,
Thank
you're
you.
glowing. Anyway, you look healthy.
Thank you.
Is that the
You
case?
do look healthy as well.
Thank you. And I think, today we try and, say this thing so we can segue into our discussion for the day.
Yeah.
And today we have another serious topic about, which is what Hude Hour really does. I want to talk about the control and prevention of a disease that's spreading or that spreads very fast,
Yeah.
but has been defeated, but sometimes has a
Surface.
resurgence,
Yeah.
as we're seeing between 2024, 2023 to 2025 now. So we're taking a look at measles. Measles is a highly contagious viral disease that remains a major public health concern, especially in regions with low vaccination coverage. Despite being preventable, measles outbreaks continue to pose significant risks to children and vulnerable populations across Africa and the world.
Immunization is a key component of the Sustainable Development Agenda 2030. Goal 3 emphasizes good health and well being for all, underscoring the importance of widespread vaccine access to prevent diseases like measles and strengthen global health security.
Today, we'll discuss the ongoing fight against measles, the challenges of vaccine hesitancy and accessibility, and the efforts being made to achieve universal immunization coverage. But first, let's take a look at our headlines. Now we have, first on the list there, measles cases in Europe doubled in 2024, highest in decades. In other news, cases in Texas surged to 279. Now we have Morocco battles measles outbreak amid falling vaccination rates. Well, we'll go on a quick break now. When we return, we'll delve further into this matter. Don't go anywhere. Now, around the globe, measles remains a highly contagious, serious airborne disease that can lead to severe complications and death. According to the WHO, measles vaccination has averted more than 60 million deaths between 2000 and 2023. Despite this success, in 2023 alone, there were an estimated 107,500 measles deaths globally, mostly among unvaccinated or under-vaccinated children under the age of about 5 years old.
The proportion of children receiving a first dose of measles vaccine was just 83% in 2023, well below the 2019 level of 86%. This decline in vaccination coverage has led to concerning outbreaks in multiple regions. Despite having a safe and cost effective vaccine available, coverage remains far below the 95% threshold needed to prevent community transmission.
Now we'll explore these challenges and the efforts to strengthen immunization programs as we progress. Stay with us. We'll be back shortly. So our first news item of the day. Measles cases in the European region surged to 127,350 in 2024, more than doubling from the previous year and marking the highest figures since 1997, according to a joint analysis by WHO and UNICEF. The sharp increase is linked to declining vaccination rates worsened by setbacks during the COVID-19 pandemic. Children under 5 accounted for over 40% of reported cases, with more than half requiring hospitalization. Preliminary data confirmed 38 deaths as of early March 2025. The region, which includes 53 countries across Europe and Central Asia, represented 1/3 of all global measles cases last year. Romania and Kazakhstan reported the highest numbers, with 30,692 and 28,147 cases, respectively. Several cases, including Bosnia and Herzegovina, Montenegro, North Macedonia, and Romania, recorded alarmingly low vaccination rates, falling below the 95% threshold needed for herd immunity. Some nations have seen coverage remain below 70% or even 50% for years. WHO and UNICEF are calling for urgent action to strengthen immunization programs, improve disease surveillance, and address vaccine hesitancy. Emergency vaccination campaigns and targeted outreach efforts are considered critical to preventing further outbreaks. Measles remains a global threat with 359,521 cases reported worldwide in 2024. The highly contagious virus poses severe health risk, including complications such as pneumonia, encephalitis, and immune system damage. Experts emphasize that vaccination is the most effective way to prevent its spread. I just want to note, first of all, that I think a lot of people don't understand that measles is a global issue and they tend to think it's only dominant in Africa. But we're seeing that Europe is being, for lack of a better word, almost ravaged by this disease. And the key issue here, which I believe is going to be reoccurring to the end of the program, is the concerns about vaccination levels and how low they are in places where you don't even expect them to be low, places where these vaccines are even being manufactured in some instances. So I think that's a real issue here that we will, in the course of this conversation, get to speak to our guest and also break it down as what's really going on the vaccine prevalence front.
Indeed, measles is a global threat. We all know it's a global threat, and that's why we see WHO and UNICEF coming together to, carry out a research on it and see that we have a lot of numbers. People are dying and getting affected with the disease, and it's a call for action, a fast action for countries. Just like you made a very very striking statement there that where countries that are not supposed to be found, lagging behind are the ones that are lagging behind, especially the ones that are manufacturers of this vaccine. So it shows that both the developed countries and the underdeveloped and the developing countries are affected with this particular disease. So it's very important that a very fast action needs to be taken. Vaccination is very important. People need to understand the power of it, and it should be included. We move to the next news item we have. The measles outbreak in Western Texas continues to escalate with 20 additional cases confirmed, bringing the total of 279, according to new data released by the Texas Department of State Health Services. Health officials report that almost all cases involve unvaccinated individuals and or those with unknown vaccination status, with just 2 cases occurring in fully vaccinated people. At least 36 patients have required hospitalization. Children and teenagers between the ages of 5 and 17 represent the largest affected group with 120 cases, followed by 88 cases among children under 5 years old. The Department of State Health Services warns that additional cases are likely given the highly contagious nature of the disease. The current Texas outbreak nearly matches the total US case count for all the previous year, last year, which stood at 285 nationwide, according to the Centers for Disease Control and Prevention, CDC. This outbreak has resulted in at least 1 confirmed measles death in Texas, the first US measles fatality in a decade. A second possible measles death is under investigation in New Mexico, where health officials have reported 33 cases, many in Lee County bordering western Texas. The CDC has confirmed 301 measles cases across 14 states this year. In response, federal health authorities issued an alert on March 7th advising parents in outbreak areas to consider an early 3rd dose of the measles, mumps, and rubella vaccine for their children. The CDC recommends 2 doses for the MMR vaccine, with the first dose at 12 to 15 months and the second between ages 4 to 6. One dose is 93% effective, while two doses provide 97% protection against the disease. Amadin, we are talking about this same, I call it a menace, and I call it a disease as well. Measles is something that, if it's not tackled from birth or from childhood, it becomes a very serious problem. And from what our news item is telling us, is talking about ages of 4 to 6, 4 to 5, and it's telling us that they are the infants. The infants are the ones that are majorly affected in, especially in the outbreak areas. So it's important that we need to understand that measles something that we need to take very, very seriously, to go out into the space to make sure that children, most especially, and every other person are being vaccinated and being saved from what comes out of measles.
Yeah, a little breakdown of the timeline here. First of all, the United States for the last 25 years has said that they were measles free, and then suddenly they had the first death since 2015. That's about 10 years ago.
Yeah.
And before that, 2015, another death was in 2023. And you know, the cases that we saw in between 2023 to 2025, 2021, 2022, they were dropping. But for some reason, in the first few months of 2025, these cases have surged. And I think it's a call to for all the health agencies, the CDC and the WHO on the international scene, to remain extra vigilant, because sometimes we see some of these bodies say that yes, a country can be measles free or disease free, and then perhaps through immigration or some other things, it might spring up again, you know, so to speak. But one, will I say, positive uh, um, angle to this is that since these cases have increased, they have also been reported that the cases of vaccinations have now are now going up again, despite being quite low for a while. So
Areas, yeah.
I think the US is a specific case of understanding how the battle is always ongoing, and when it comes to health issues, your health is my concern as much as mine is, and at the end of the day, that's how public health remains sane. All right, we will go on a break now. When we return, we delve into our final news item of the day. Don't go anywhere. We'll be right back. Welcome back. So our final news item. Moroccan authorities are working to contain a measles outbreak that has surged amid declining vaccination rates. Once nearly eradicated, the disease has reemerged with over 25,000 cases and 120 deaths reported since late 2023. In response, a large-scale vaccination campaign has been launched, with more than 10 million school children having their immunization status checked since 20, or pardon me, since October. Officials aim to achieve 95% vaccine coverage by the end of March to establish herd immunity. However, only half of those needing booster doses had received them by early March. Health officials attribute vaccine hesitancy to misinformation, which has persisted since the COVID-19 pandemic, public concerns over vaccine safety fueled by global anti-vaccination movements have contributed to lower immunization rates. Authorities have intensified awareness campaigns, particularly in schools, to counter false claims and educate parents on the importance of vaccines. The outbreak has drawn international attention, with France warning travelers about the rising cases. Meanwhile, Morocco has reported a decline in new infections in recent weeks, but continues to push vaccination efforts to prevent further spread. Measles remains a highly contagious disease that can lead to severe complications, including pneumonia and brain inflammation. Experts emphasize that vaccination is the most effective way to control outbreaks and protect public health. Well, Morocco is going through it as we're seeing in other parts of the world. Basically, we've gone through these different continents. We started out with Europe and the record cases. Then went to the United States, where a case or a death hasn't been seen since 10 years. And the measles has been said to be eradicated for about 25 years or so. And now we are going to Morocco, who seem to even have it a bit worse off because we're seeing multiple deaths there. But again, I think what we will get to, know more. What I'm concerned about is how we can make the issue of vaccine hesitancy end, for a long while, sustainably. Because it seems as though even societies where this should be common knowledge that do not have as much gaps as other developing parts of the world, they somehow still found a way to enter this loop or this era where they don't see the importance of vaccinations. Again, it calls to the issue of vigilance. What do we need to do to ensure that periodically people don't just suddenly have a drop in trust or in interest in protecting themselves and preventing diseases?
I would like to find out more from our guest when he comes on board for us to know what are those strategies they are using, to make people accept vaccine, because it is a thin line now between vaccine acceptance and vaccine hesitancy. And one thing is for the vaccine to be provided, and another thing is for the individuals to receive the vaccine. So and they need to be educated to know that by the time this vaccine is being received, the measles and every other disease that is to come up will be attacked and they'll be free. So I would really want to know those strategies and policies they use.
Indeed. All right. We will go on a break once again, and when we return, we'll be joined by our guest. He is a medical doctor. He is Opara Kelechi John. He'll be joining us just after this break. Don't go anywhere. We'll be right back. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people, and let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
In the studio by a medical doctor, talking about Dr. Kelechi Opara John. He joins us now to break down the global health concern that is measles and how relevant it is to get the prevention and control under works at the moment in 2025 particularly. Welcome, Dr. Kelechi. How are you doing?
Doctor.
It's good to have
Good
you.
to have you.
All right. I would always like to ensure our viewers are adequately following. We've been mentioning measles all along. Can you just give us a very quick and simple breakdown of what exactly this is, how it spreads, how can it be prevented on a basic level?
Okay. So basically, measles is a viral infection, and it's a very highly contagious viral infection. So basically, someone that has measles can affect like 90% of the people around him because that's how infectious it is. So basically, this measles virus can stay up in the air for up to 2 hours. So it can stay that long. So if a person talks, coughs, or sneezes, that virus can come out of the person's orifices and stay up in the air for 2 hours. So any person passing within that period of 2 hours and is unvaccinated has a high risk of actually getting this measles virus. So basically, we'll talk about the symptoms. It has several stages. There's an incubation stage where you have like 7 to 14 days and the person doesn't have a symptom at that stage. Then afterwards, there's now a prodrome phase where initially the person begins to have this, we would say, malaria-like symptoms. You'd have fever, malaise, feeling of unwell, loss of appetite during that initial stage. Then afterwards, the person begins to start having cough. There are these 3 C's you mentioned: cough, conjunctivitis, and coryza. Coryza is like rhinitis. Basically, the person will have stuffy nose or running nose within that prodrome phase. Prodrome phase lasts like 2 to 4 days afterwards. And then there's a classic thing you see in measles that when you see it in the person's mouth, it's pathognomonic to know that that person actually has measles. There's this thing they call coplic spots in the mouth. So basically, the person opens the mouth, between the molar, at the edge of this mouth, the buccal cavity, you see these, it looks like salt granules on the mouth. So it's called coplic spots. And around it, you see a redness around it. So any person you see with that spot, classically, it's measles until proven otherwise. So basically, that happens during that prodrome phase. And then there's the second to last phase, which is called the xanthem phase, where you see the classic rashes in measles. So these rashes in measles is like, it's called a maculopapular rash. You see some raised lesions, you see some lesions that are not raised, and it's reddish in nature. Yes, so these rashes are like less than 1 cm in size. So those rashes actually come out during that third stage. And so basically, that is the rashes you'd see, and ideally, people would think the person has measles together with the fever. And that fever is really high. You can get a fever of up to greater than 39 degrees Celsius. Normal person's temperature is like within 36.5 to 37.2. So you can imagine a temperature of over 39 degrees Celsius. So the fever is really high. And then this measles virus affects several parts of the body. It can affect the lungs, causing pneumonia. And pneumonia is actually the most common cause of death in these people with measles, children with measles, this pneumonia. It can also cause diarrhea. It can cause some ear infections because basically measles can affect the respiratory tract, as the respiratory tract, and then it can migrate. There's an opening that leads to the ear from the respiratory tract. So it can go through that place and then cause an ear infection, otitis media as well. It can go to the digestive system because basically the virus is in the air. You can inhale it, can go through your eyes and then cause a kind of eye infection, keratitis and all, and can even lead to blindness if left untreated. And then can go through your nose, enter into your respiratory tract, and causing that pneumonia we talked about that is the most common cause of death. And then it can also go to your digestive system and then causing that diarrhea that one could present with. So basically, all these symptoms are, very, and it can lead to complications, severe complications. So I mentioned earlier on, it can lead to brain damage too as a complication.
So,
Yes.
pardon me, even after you are healed, that brain damage persists.
If that has already happened, it could persist afterwards. There is even a long-term complication of measles. It's called subacute sclerosing panencephalitis. I know it's a mouthful, but then it's affecting the entire brain. Basically, panencephalitis is that affecting inflammation of the entire brain. It can lead to person having seizures, and then at the end of the day, brain damage and death. So those are very severe complications of measles if left untreated. But if you are able to vaccinate, but then you're already affected, there's a thing measles does in the pathophysiology. When measles affects someone, and afterwards the person gets long-lasting immunity, right? There's only a 3% risk of actually getting. You get 97% immunity after you've been affected with measles. But the thing is that measles leaves like a mark on the person's body. It decreases the immune system. So if it affects you, you get immunity against measles, but then your immunity against other diseases is declined. Exactly. So you need time for immunity to adjust to other diseases. Our body system is structured in a way that when we get infected by a disease, especially viral diseases, the body tends to like have a memory of these viral diseases. So just in case it happens again, they would react quicker and be able to, take care of that disease. But if measles affects someone and the person gets, that natural immunity from it because the body has gotten used to it, it decreases the immunity for other diseases. So basically, the body will not be able to react as quick as it used to. That memory cell would be lost. And then people can easily get secondary infections because of that declined immunity. So that's the thing. So usually there's this notion that people have that, that's even one of the reasons for vaccine hesitancy. They're like, they would prefer a natural immunity to things because it's just measles to come and go, and then we get immunized and we don't have to worry about getting the vaccine. But then that it's called, there's a term Americans usually call it immune amnesia. So it affects the person. You get declining immunity for other bacterial infections and other viral infections as well. But then of course you're immune to the measles distance. So it's somehow.
That's really interesting. And I think I love that you've already broken that misconception here, especially for people who want the real immunity, as they might call it. So let's move now to what's happening in recent times. We've seen sort of a surge, especially in March, say in the US particularly, in the past, let's say 3-4 years. The cases that came up in just these few months of 2025 are actually more. We've even seen a death or two. I would like you to break down what do you think is the reason or the rationale behind this spread, geographically speaking. We also have Europe having some issues. We have Morocco. How would you break down what's happening here? What's the cause or what's the underlying issues that is causing this? Especially when we take into mind, like we said before, that a place like the US said they were 25, or for 25 years, I've said that they are basically measles free. And suddenly it comes back up again.
Yeah.
So what do you think is the underlying reasons for all of this?
Okay, so basically measles don't really affect just children. They affect older adults as well. So there's a thing that happened between the period of 1957 to 1963. So during that period, the vaccines that were actually created for measles were vaccines of, how vaccines are made is that virus is cultured some sort. And then there are vaccines that the dead virus will be used as the vaccine. So when the dead virus is given to the human body, the body generates response to that virus, that memory we talk about. And so during that period of time, from 1957 to 1963, it was just that dead virus that were used. It wasn't as effective. It wasn't going to give you that immunity that you require against measles during that period. So you could say they were just partially vaccinated during that period. Recent times, you realize that it's now what is called the live attenuated vaccines for measles. So these ones, the actual measles virus is actually alive in the vaccine. It's just that, the effects are suppressed in this case. It's called live attenuated. So basically, the impact is not as much as an actual virus, the measles virus.
Yeah.
Yes, so basically, those are the vaccines that are given. So those people within that period can still get infected by measles. It's as good as they are not exactly partial vaccination. So basically, what is causing this new insurgence in measles is that people are traveling from, there's this, the world is now a global place. You can easily travel from one country to another. So you can get people traveling from areas that are unvaccinated and then moving to America, those areas that, they initially thought they are completely vaccinated. So you get older adults that were born within that period of time. You know that measles vaccines are usually given in young children now. You get the one of 12 to 15 months, two doses as we mentioned, 12 to 15 months, then the one after 4 to 6, within 4 to 6 years. So you get people born during that period of time who were not actually vaccinated, partially vaccinated. So then they grow up to become older adults, and then someone traveling from an unvaccinated environment comes in there, and then gets to spread the virus. And you know how highly contagious it is. So that risk is increased. So you get those people getting affected.
All right. Thank you so much, Doc. I want to ask you, COVID-19 back then, how do you think it really affected the measles and all the vaccination coverage? And also, we talked about vaccine hesitancy and vaccine acceptance. So, what are those strategies? What are those policies that you, likes of you in the medical line, health practitioners, are doing to, talk to these people to ensure or to build that trust, for people to accept vaccines?
Okay. The first question is about the COVID-19, right?
Yes.
Yes. So during that period of COVID-19, there was a lot of lockdowns to get. Health facilities weren't as functional as it used to be. You see people not going out, they're all in their rooms. So you can imagine children growing up within that period of time. So you won't be able to go out to get those necessary vaccines. So some vaccinations were omitted during that period. So you see children missing their vaccines at that period of time. So they were unvaccinated and then, easily exposed to this measles virus. Yeah, so that is how it contributed, the COVID-19 contributed. So you get a lot of unvaccinated people during that period and then spread increased. And so how we are, planning to contain this is public awareness is very important. We need to educate the public, on this vaccine hesitancy. A lot of people are, because of those misconceptions they have. I mentioned one earlier on the natural immunity. Some people feel like the vaccine is actually them giving you the actual measles virus. During that there was a thing going around about the COVID vaccine. That time it came out when they were saying this COVID vaccine, there are things about it that it actually be giving one COVID. Yeah, so a lot of people have that notion, mentality about the measles vaccine. They're actually giving measles. Then there's this misconception I would like to clear out. Some people actually get vaccinated and then they realize that they're having fever afterwards. You get to see some symptoms of as if it's like measles. So you get that, and then some other people see it in them and then get that misconception about measles. So I want the audience to remember that it is a live attenuated vaccine. So it means the measles virus is just weaker than it used to be. So within 7 days after getting the vaccine, you can get some symptoms similar to measles. But at that point, you're not contagious. It's just a weak vaccine. Your immune system is trying to adapt to it, to respond to it. So you get those symptoms of fever, you get some kind of itching at some point. Then you can get pain at the site of the measles vaccine getting. But just to let the public know that you are not contagious at that point. And then those symptoms resolve within a few days. So it's nothing to worry about. So we need to educate and enlighten the public on the importance of this measles vaccine and the complication of relying on natural immunity rather than actual vaccinations. So that is very important.
All right.
So,
All right. So that's fair enough. There's a word that keeps popping up when these conversations happen: herd immunity. What is the importance of that here, and how do we get there to ensure that we're all protected? And also to speak, like we've mentioned, the US, I think at some point, even Canada had that same status of being quote unquote measles free at a certain point. How do other nations, developing nations, get to that point? Bearing in mind this concept of herd immunity, how does it work?
okay. The principle of herd immunity is having a large percentage of people vaccinated. Up to 95% of people get vaccinated. So you've reduced the risk of of measles being communicable to unvaccinated people. There are specific group of people that have a higher risk of having complications from measles. You get a very young age, children less than 6 months of age, they have a high risk of getting measles. You get pregnant women, they have a higher risk of getting complications from measles. You also get people that are immunocompromised. Immunocompromised people are people that have reduced immune system. You get so basically when you get a measles virus, the immune system can't respond very well to measles, so you get a lot of complications from that. Yes. So these people, particular people, are very, very reliant on this herd immunity because if you have a large population of people getting vaccinated, you reduce the chances of measles being transmitted to those people that have a higher risk of having complications. You get being highly contagious is a reduced risk because you have maybe 95% of people being vaccinated. So the virus can't survive. It's just 2 hours, basically, it survives in the air. So if it survives, it relies on affecting between human to human host. So basically, if you leave the virus in air for longer than 2 hours or more, let's say 6 hours and all, it dies, it goes away. So having that large percent of people, you have a higher risk, or a higher chances, of decreasing the rate of transmission, and then reducing the chances of it actually getting infected to those people that are, higher risk, those younger adults, older adults, young children, and then pregnant women as well. Very important.
I'm sorry to cut in. Just a question of curiosity. This requires people being vaccinated, right?
Yes.
And do you bear in mind the population of countries, or is this something that even developing nations have the capacity for? I understand other nations, could be able to realistically do that. What are the things in place for a nation? I mean, we have Africa, we have Nigeria, the most populous Black nation, hundreds of millions of people. How do you ensure that, assuming vaccine hesitancy is not even an issue, the actual logistics of it, do you think strategies make it feasible?
The thing about it is government policies and government budgets. So the thing about this thing, if you make something actually free or, like cheap or free, you educate the audience on the importance of it, you get a lot of people coming to receive that vaccine. They get motivated to actually receive these vaccines. So if government policies are put in place and these vaccines are almost free, or even free itself to people to afford, there are a lot of people coming to get vaccinated. So we can use that means to actually vaccinate at least 95% of people with these vaccines. So that's it basically.
Okay, so what are the serious complications you think parents, individuals need to know about the measles, and how can the health practitioners help the communities to tackle this situation on ground?
Okay. First of all, before these complications, parents need to know how to like detect when a child is actually having measles. That's why I started with trying to explain the symptoms and signs. The early symptoms, so you have those fever, malaise, and then that classic symptom I mentioned, that Koplik spots, when you examine a child's mouth and you see those spots there. So when a parent detects this, it's very important to isolate your child. You get isolation is very important because at that stage the child is highly contagious. Even you yourself is the most likely that if you're not vaccinated, you're obviously infected. You need to isolate yourself as well. So isolation is very, very important. Hygiene is also very important. Aside being in the air, measles can also, stay on surfaces for that long as well. So you need proper hand washing, clean environment, and all that stuff. So then, aside that, the vaccine is, how do I put it? Please just remind me of the question again.
Okay, I said, what are those medical community approach to treating the disease in the community?
And the complications that arise.
Okay. So basically, the complications, we start with the complications now. One can have pneumonia. Yeah, that pneumonia is the most common cause of death. Okay. Yes, so pneumonia, interstitial pneumonia, and as the lungs are infected and all that. Then another very important complication is blindness, because measles can affect the eyes, cause keratitis, and in the long run cause blindness. Then we mentioned there's this thing I said earlier on, this subacute sclerosing panencephalitis, where it affects the entire brain. Exactly. So all these complications are those things you need to be really aware of from measles. Then once a child has measles, it's very important to get post-exposure prophylaxis. To get a child that has measles needs to be vaccinated almost immediately. So basically, if it's a child greater than 6 months of age, you can get the measles vaccine, the first dose immediately within 72 hours of initial exposure. And after getting that first dose, of course, you're now 93% chances there. Then you get the second dose within 28 days after the first dose. So the first thing, isolation, very important so that you don't spread it to others. Hygiene is very important. And then you get that vaccination as soon as possible within 72 days, 72 hours, sorry. And then you get the second dose, the booster dose, 28 days afterwards. So that is very important. Another thing is that there are some people, like those people that are immunocompromised, those people that don't have immune system, they are contraindicated to actually getting these immune vaccines because these vaccines will further worse because their immune system can't respond to this vaccine to generate the adequate immunity to continue. So these people, you can't actually give them measles vaccine at that point. So what is actually given to this set of people is immunoglobulins, antibodies to the measles to fight the actual infection that is ongoing. So you give those immunoglobulin within 6 days of exposure, you get. And when you give the immunoglobulin, then they help treat that infection temporarily. Immunoglobulins only lasts for a little while. The person needs to still get vaccinated at the end of the day. But at least you'd have that time to actually build your immune system up to, let's say, 6 months after. Then you can get the measles vaccine, actual measles vaccine for this set of people.
All right, thank you so much,
So
Doc.
that's it.
All right, just in a few seconds, just tell us how we can eliminate measles, from 2025 and beyond, because we want to live in a measles-free environment and a world at large. So, what are those research that the public health officials are doing to make sure that measles are eliminated completely?
Okay, there are research going on how to further enhance how you distribute vaccines. I think I saw a paper writing on how to make it accessible, like inhalation. Inhalation means rather than injection. So one could just have some kind of inhaler to inhale it and then get it's a very good means of actually getting people, a larger number of people vaccinated. Then aside that, there is no way of putting it. It's just vaccination. Get as much people as possible being vaccinated so that you can get that herd immunity and then reduce the chances of measles being spread to other persons. And then there are government policies that have been put in place to ensure that children are being vaccinated. In schools, there are mobile clinics that people can actually meet children in accessible areas, meet children in schools, get them vaccinated in schools, because you get children of that age, less than 5 years, in schools, daycares. So you can go there, actually get children vaccinated. And then the thing about, because what caused the insurgents in the United States is these traveling policies, people being traveling from one area to another. So before a child actually travels, they get tested. There are laboratory testing to check the antibodies that one has developed against measles. The antibody titers, okay, this is a lot, but antibody titers of greater than 120, they will check it and confirm that you're actually immune to this measles, whether you got a natural immunity or you're actually vaccinated before you're allowed to travel to a foreign country. So those policies and measures need to be put in place to reduce the risk of this transmission.
Thank you so much, Dr. Kelechi. This was very educating and impact-filled session. It's good to have you here breaking down misconceptions and creating that awareness that you've just spoken about, because that's what we're doing right here. Thanks so much for coming.
Thank you.
Thank you very much.
All right, that's how we end this segment of the program. We will go on a break. When we return, we'll delve into our Verified Voices segment. We have been speaking with Dr. Kelechi Opara. He's been telling us about measles control and prevention. I mean, I got a couple of things here that I think is very important. You should, opt to get vaccination rather than the natural immunity, because it could lead to some other issues as well as a host of other things. And those persons who are immunocompromised, as they say, might not be able to get the vaccines, but there are other ways out there for you. Do stay protected and stay interested and care for yourself and others as we aim to tackle this disease, prevent it and control it. Don't go anywhere. We'll be right back with Paul Oladipupo.
Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people. And let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in, and let's drive straight into the hearts of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
Welcome back. This is still Hude Network and Hude Hours, Hude Network right here. And this is the Verified Voices segment. We have been joined by Paul Oladipupo. Hello, Paul.
Hi, Amadin. How are you doing today? Hi, Joan.
Hi, Paul.
Hello, Paul.
Hope you all are doing good.
Well, great.
Thank you.
Okay, now let's see what today we have on Verified Voices. It's been a lovely talk since the beginning of the show, talking about measles, one of the world's most contagious diseases that we have today. Let's see what we have for us. First tweet from UNICEF, the Gambia UNICEF. This says, imagine the Gambia free from measles. It is possible through vaccination. On World Measles Day, let's remember, measles is preventable. Vaccines are our strongest defense. Every child deserves protection. Vaccines against measles are available at all health facilities across the country. At UNICEF Gambia, urges parents and guardians to ensure that children are fully vaccinated. Together, we can close the immunization gap and ensure a measles-free Gambia. Hashtag vaccine works, hashtag UNICEF Gambia at 60. It's actually lovely to see what vaccine is doing in Gambia, right? Because over the years now, for about 3 years now, the average cases that they've had of measles is about 32. and it just shows how vaccine work. Although they are not at that stage, the stage where you say that they already have herd community immunity, as we've been talking about since the beginning of the show. But they are already close to that number in the real sense of things. And I feel with just a little more work done, they get to the 95% that is expected for us to have that herd immunity.
Yeah, it's an interesting one, really. And I think with Gambia, the key aspects were mentioned: vaccines, the fact that it's affecting children more, and all of that. So I think it's important for them to point out that those who are more vulnerable and put them at the center stage. So it's a nice bit of awareness there.
Exactly, it's really a nice one. Let's quickly move on to the next tweet right now. The next tweet is from WHO West Pacific. It says that the measles vaccine has saved an estimated 5 lives every second since the 2000s. Prevents measles by getting vaccinated with 2 doses of measles vaccine. Measles is preventable with just 2 doses of measles vaccine. It is very interesting to know that there are actually 2 doses of measles vaccine. The very first one is around 12 to 15 months, and the second one is around 5 to 6 years of age. And really, it's expected that we take both doses to ensure that we're actually immunized against this particular disease. And one thing I've noticed through my research is the fact that some people get the first dose and then don't come back to get the second dose. And some people might argue that maybe because some of those who get the first dose don't live a long time to be able to get the second dose. But however, the numbers are really low, and there's a very big gap. For a country, for example, like Nigeria, where we have the percentage of those who receive the first dose around 60%, and then the second dose around 43%, that's a very huge gap if you should look at it in total, actually. So it's to be sure that we're actually measles free, it's important that we take both doses, the first dose and also the second dose of the vaccine. Let me take the next tweet quickly because of our time. The next tweet, this is from Gavi, the Vaccine Alliance. They say that measles is one of the world's most contagious virus. One person can infect as many as 18 others, and you can get measles just by being in a room where an infected person has been, even up to 2 hours after the person has left. Stay protected and learn the facts this World Measles Day. This Gavi, the Vaccine Alliance, is one of those strong groups that actually talk about getting vaccinated, ensuring that people are vaccinated, especially children. Today, they've been able to drive their vaccine. They've been able to spread the gospel of vaccine and be able to give about 1.1 billion children vaccine as at today. And it's very interesting to see the kind of great work that they are doing right there. That's talking about the Gavi Alliance. I'll take the last tweet now as well so that we wrap things up. This is Craig Spencer, is a Twitter user and also is an ER doctor. He is saying that my 4-year-old went to his annual checkup today. He got his measles, mumps, rubella, and varicella, that's MMRV vaccine today as recommended. As a physician, I know how this will protect him, especially now. And as a parent, I trust the safety of the vaccine. I know that there have been debates here and there about whether the vaccine is safe or not. It's important that we know that the vaccine is safe. This is coming from an ER doctor in Rhode Island right there, and he's saying that vaccine is actually very safe, right? And if you can all get the vaccines, will be good. We understand that there's been back and forth about the vaccine since since COVID-19 actually happened, and it's quite sad to see that happening in the real sense of things. But if we could, we're seeing rise in cases in places like the US now. Canada has over 200 cases just in 2025 alone. All of these numbers are not good, and Canada is coming from a place where they've not had any case of measles in a very long time. And now that we are seeing rising in number of cases in all of these regions, which is really, really sad in the real sense of things.
Well, you've said quite a lot, from the first to the second to the third and to the fourth verified voices we've had. And all of them is still portraying the same thing, getting vaccinated all over the world. children. I literally love the pictorial representation I saw there. A child with the being vaccinated.
Yeah, with the mother.
And talking about just two. It takes just 2 doses. It's not much, it's not too painful. I mean, it might be, but it's for...
It's just a little pinch in the real sense of things.
It's just for your safety. So, and of course, the testimony we got from the doctor, Dr. Greg, is very, very important because it shows that this particular public health official is coming out to testify that he knows what is important for his child to be vaccinated. So for a doctor or for a medical practitioner to start from his own abode, it's also advisable for other people to follow the step because these people are well knowledge about it.
Exactly. I
Well
mean,
done, Paul.
the doctor right there, talking about Dr. Craig, is not just a doctor, an ER doctor. Is also a very big time. He's big time when it comes to global health issues and things like that. He has very strong takes, and really, this is him showing, leading by example. That's what they say in the real sense of things. I think that's all we're going to take today on Verified Voices. It's been a lovely episode so far. Till I come your way again, my name remains Paul Oladkupo.
Thank you, Paul.
Thank you so much, Paul. It's been a lovely one. This was an enlightening segment right there. But that's how we draw curtains on our program for today. Don't forget, you can always join us 8 a.m. every every Wednesday. And we will bring to you more Hude Hour, and we break issues down within the humanitarian and development space. Don't forget to join us. I hope you learned a lot, and I hope the advocacy continues in the path to sustainable development. Have a nice day. I am Amadin Ogbewe.
It is important to get vaccinated. I am Joan. Bye for now. Thank you so much for joining us.